This podcast represents a brief history of the law relating to the issues raised. This should not be relied on as a substitute for professional advice. Specific legal advice should always be sought in relation to any particular circumstances, and no liability will be accepted for any losses incurred as a result of reliance on this podcast by those relying solely on this podcast. Welcome now to Hicksons Health Hour, the podcast series that explores a variety of current legal health topics. Throughout each episode, hear from different members of our health team with expertise in the area. My name is Stojkova and I'm Special Counsel in the health team.
And my name is Demi, Associate in the health team.
Every state and territory in Australia has its own laws and regulations as to when medical termination can be accessed and who is authorised to provide and assist in terminations. Today, we address the Queensland Government's new laws allowing midwives and nurse practitioners to prescribe medical termination pills as of March 2024. So to begin with, can you please give us a history, Demi, of medical termination?
Yes, so performing a medical termination is defined in Queensland under the Termination of Pregnancy Act 2018 as being able to prescribe a treatment dose of a termination drug, such as MS2-step, to terminate a pregnancy or administer or give a treatment dose of a termination drug for use in the termination of pregnancy. Prior to August 2023, restrictions were in place by the federal government's Therapeutic Goods Administration, also known as TGA, to require medical practitioners to register and be certified to prescribe the drug MS2-step, mifepristone and misoprostol used for the medical termination of an intrauterine pregnancy up to 63 days gestation. These regulatory steps meant that only doctors were permitted to perform a termination of pregnancy, whether medically or surgically, with only 1 in 10 medical practitioners being able to prescribe MS2-step and 3 in 10 pharmacists being able to dispense it. In Queensland, women are able to elect to have an early medical termination up to 9 weeks gestation by taking the termination drug MS2-step. For women living in rural and remote areas in Queensland where doctors are scarcely available, this meant that access to termination of pregnancy services, particularly the less intrusive methods, were limited. To access these services, women had to travel long distances, which potentially added to the pre-existing social and financial burdens.
We understand that the TGA has lifted some restrictions in the prescription of MS2-step. What restrictions specifically have been lifted, and what effect has this had on accessibility for women wanting to choose early medical termination?
In August 2023, the TGA lifted a number of restrictions as to who can prescribe MS2-step. Now, any healthcare practitioner with appropriate qualifications and training without the need for certification can prescribe the drug. Furthermore, all GPs across Australia will no longer be required to undertake mandatory training and registration every 3 years to prescribe the drug. And restrictions on dispensing the drug to limited registered pharmacists has also been lifted. This decision greatly assists in improving access to medical termination services, although please note that the laws of each state and territory vary.
All right, so let's talk about Queensland and its progressive movements to increase accessibility to medical termination. Specifically, what steps has the Queensland government taken in this regard?
In light of TGA's amendments, the Queensland Government amended their pre-existing Termination of Pregnancy Act 2018 to include a section allowing nurse practitioners and endorsed midwives to prescribe the medication to enable medical termination. Registered nurses and midwives may also prescribe medical termination medication. However, they are subjected to additional requirements in that they have to be authorised to do so by way of an extended practice authority. The authority includes the place or circumstances in which a midwife or nurse may deal with a regulated substance, here MS2-step, impose conditions on how the substance is dealt with, and require the midwife or nurse to hold particular qualifications or training to deal with the substance.
So are there any training requirements at all for nurse practitioners and midwives?
As part of the public briefing of the legislation prior to its passing in December 2023, the Health and Environment Committee indicated that additional education and training resources would be developed to support health professionals in their role in providing termination of pregnancy care. It was said that the resources would align with the Queensland Clinical Guideline for the termination of pregnancy and a standardised clinical pathway for termination of pregnancy using MS2 step. Apart from this, it does not appear that nurse practitioners and endorsed midwives are mandated to undertake any additional training to be able to perform the medical terminations.
This appears to be in contrast to the previous requirement for GPs to undertake mandatory training and registration every 3 years to prescribe MS2 step. Surely it remains advisable for all healthcare practitioners to ensure that they have up-to-date, appropriate and recognised training, qualifications and experience for the services they provide.
Yes, certainly. However, at this stage, it appears that training is only mandatory for those registered nurses and midwives who want to practice under an extended practice authority. As of September 2024, the Queensland Clinical Guideline for the Termination of Pregnancy was published, and new versions of the extended practice authorities for registered nurses and midwives were commenced. The EPA provides that if the credentialed scope of clinical practice for a registered nurse or midwife includes administering or giving a treatment dose of MS2 step, they must have successfully completed early medical termination of pregnancy training. This is said to be a course approved by the midwives or nurse's employer that includes, at a minimum, education about early medical termination of pregnancy medicines, including indications, contraindications, management of common side effects and administration, confirming pregnancy and gestation, pre- and post-termination counselling, cultural safety, mental health assessment and psychosocial screening, screening for domestic violence and reproductive coercion, screening for sexually transmitted infections, contraceptive device, appropriate management, and escalation and follow-up. The midwife or nurse may then be approved by their employer to practice under the Extended Practice Authority. For other nurses and midwives without an EPA, they will only be able to administer MS2 step on a prescription obtained from an authorised prescriber, including a doctor, nurse practitioner, or endorsed midwife.
Following in the footsteps of Queensland, other states and territories, including the ACT in June 2024 and Western Australia in late March 2024, now allow authorising nurse practitioners and endorsed midwives to prescribe MS2 step.